Foundation Module 9 is Modular Integrated Undergraduate Curriculum Physiology. Sheikh Zayed Medical College Physiology Department. Dr. Sheen, CEO and founder, Medical Superfast Simplified Physiology Video Lecture Notes. Guyton and Hall 14 edition, lecture number 17, chapter 38, page 497. Learning objectives. Define minute respiratory volume. Is the total amount of new air moved into the respiratory passages each minute, inhaled or exhaled by a person in 1 minute. It is equal to the tidal volume, 500 milliliters, times the respiratory rate per minute. The normal tidal volume is about 500 ml. The normal respiratory rate is about 12 breaths per minute. It is calculated by multiplying the tidal volume by the respiratory rate. MRV equals tidal volume, TV, x respiratory rate, RR, equals 500 milliliters multiply 12, equals 6,000 milliliters, 6 liter/minute. A person can live for a short period with a minute respiratory volume as low as 1.5 liter/minute N and a respiratory rate of only 2 to 4 breaths/minute. Normal values, 5 to 8 liters per minute. During exercise, can increase significantly, 40 to 50 breaths/minute. Tidal volume can become as great as the vital capacity, about 4,600 milliliters in a young man. Minute respiratory volume becomes greater than 200 L/minute, or more than 30 times normal. Factors affecting minute respiratory volume. Physical activity, body size, lung health, respiratory diseases. Significance. Minute respiratory volume is essential for maintaining proper oxygen intake and carbon dioxide removal from the body. Abnormal minute respiratory volume can be a sign of respiratory problems such as asthma, COPD, or pulmonary edema. Measurement, using a spirometer or other respiratory devices.